Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Hello.
Hello.
Rosemary, we've got a question from a 19-year-old student studying A-levels at college. Now, last week she says she was sick every morning, and so she decided to take a pregnancy test. The test was positive. She says that she feels really ashamed, but she's decided to get an abortion, and she wants to know from you that if she does this, will it harm her chances of having children in the future? She's clearly in a difficult place, isn't she?
Very, very unlikely it will harm her chances in the future. I can't say categorically that it won't, because all operations, and that includes terminations of pregnancy, they all carry a very slight risk, but most terminations are very straightforward indeed. If she's already 9 weeks pregnant, she's too late to have a medical termination, which is when you take the tablets and it just induces a very heavy bleed, like a late period. She will actually have to have a small operation. The main thing to be aware of afterwards is that the bleeding should stop within a few days. If she has heavy bleeding or if she has pain, it could be a sign that she's got an infection, and that could damage her chances in the future. Now, very, very, very rarely the womb itself can be damaged by a termination procedure. But again, it is so, so rare. But you have to go into this type of thing with your eyes open.
Yes, and she's talked about feeling ashamed. So do you think some counselling would be helpful? Does she need to talk to somebody about this?
Well, yes, and in fact, nearly universally now, if you go to an NHS clinic or a private clinic to discuss termination, you will get counselling as part of that procedure, because it sounds as if there's a little bit of ambivalence there about whether she really wants to have a termination or not, and so she needs to talk it through with somebody. And even though she's doing A-levels now, there is lots of support for teenage mums with babies so that they can carry on with their education in college, and that may be an option for her.
Yes, if she wants that choice. She just needs to find the path that she needs to take, doesn't she?
Yes, and the other thing she needs to do is, if she goes along to her GP surgery, she needs to actually have a quiet word with the receptionist. Make sure she sees a doctor who is sympathetic to termination. There are quite a lot of GPs now who aren't sympathetic to termination, and if your mind isn't quite made up, and you end up in a scenario where you have a doctor saying, well, I don't go along with that type of thing, it can be devastating. So you need to go and make sure you go and see the right doctor from the word go.
Very good advice. Thank you, Rosemary, for answering that question. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.